I'm 103 years old, and this morning I had eggs and bacon for breakfast. I had my gallbladder removed 20 years ago, when I was 83. The doctor told me, strict diet, be careful, no fatty food for the rest of my life. If you clicked on this because you're waiting for me to tell you the secret to living long, you clicked on the wrong video. I genuinely don't know why I'm still here. What I do know is that 20 years ago, someone sat across from me and explained very convincingly exactly how and why I was going to suffer without that organ. And then I just didn't. No gallbladder, 103 years old, still here. My name is Clarence Whitmore. For 40 years I worked as a surgical assistant. You know what that means. I helped remove other people's gallbladders. I handed the instruments, passed the clamps, watched the surgeon do the exact thing that was eventually done to me. I knew that operation from the inside, long before I ever laid down on that table myself. It was August of 2003. I was 83, and for a few weeks, I'd been getting this dull ache in my right side after meals. Nothing sharp, just this heavy grinding feeling that made you want to sit very still and wait for it to pass. My Beatrice kept saying, "Clarence, you know what that is. Don't drag your feet." She was right, same as always. The surgeon was a young fellow I remembered from when he was still a resident. He looked at the scan and said, "Gallstones, Mr. Whitmore. Serious ones. It needs to come out." I sat there looking at him, thinking about how many times I'd stood on the other side of that conversation, how many times I'd been in that room while someone else got the news. And here I was, sitting in the chair, listening. Dennis flew in from Atlanta the next day. He was around 50, and he looked like he was already rehearsing a eulogy. He sat down next to me and took my hand. "Dad, it's going to be fine." I looked at him and thought, "Son, I've assisted on hundreds of these operations. You don't need to feel sorry for me." But I didn't say that. I let him hold my hand. The surgery went without any complications. Standard laparoscopy, 3 small incisions, nothing unusual. Afterward, the young doctor came in to explain how life would work now. Fat, keep it minimal. Fried food, not a good idea. Heavy meals, small portions only. Your gallbladder stored bile for digestion, Mr. Whitmore. Without it, your digestive system needs time to adjust. I nodded along. I already knew all of it. I'd said those same words to patients myself. No gallbladder, 103 years old, still here. I lay in that hospital room that night, and I wasn't thinking about the surgery. I was thinking about Beatrice sitting out in the hallway, knitting, because she never could just sit and wait without doing something with her hands. I was thinking about the fact that I knew everything medicine knew about this organ, and that I was now living without it. There's a strange feeling when your professional knowledge becomes your personal situation. The first 2 years I followed every instruction they gave me. Small portions, no fried food. I checked every dish before I ate it, wondering if it was too rich. I carried a little mental list of what was allowed. Beatrice cooked differently for me, never complained once, just quietly rewrote her recipes around my new rules. Even though her gallbladder was perfectly healthy, and she could eat anything she wanted. I spent those 2 years living in a kind of permanent standby mode, waiting for something to go wrong. Any little discomfort in my stomach, I'd stop and analyze it. Heartburn after dinner. Was that a sign? Heaviness after lunch. Did I do something wrong? I'd spent 40 years in operating rooms and seen things that would make most people lose their appetite entirely. And here I was, tiptoeing around my own kitchen like I was walking through a minefield. That, I'll tell you, gets exhausting. You probably know that feeling, when the condition itself isn't even the scary part anymore. What's scary is breaking the rules, doing something wrong and feeling everything start to fall apart. I lived with that every single day, 2 years, every meal, a small test. One Sunday, I was walking past Ralph and Dorothy's place, and they were frying chicken, and the smell stopped me right there on the sidewalk. For 30 years we'd gone over there every Sunday. That day I stood there, breathed it in, and walked home, because I didn't know how much oil was in that pan. Beatrice went without me. That became a habit. I stopped going to Sunday dinners. Ralph would ask about me. Beatrice would pass it along. I'd say, "Tell him I said hello." It was awkward to explain. My son Dennis would visit and look at me with this relieved expression. "You're eating right, Dad. That's good." And I understood that his worry fed on my caution. The more careful I was, the calmer he felt, which meant I owed him that caution. We'd both built our lives around an organ that wasn't even there anymore. Then one afternoon, my grandson Tyler, he was around 20, just started medical school, asked me with this academic curiosity, "Grandpa, how do you manage without the bile reservoir? You've got constant bile draining into your intestine. That must affect how you digest fat." I looked at him and thought, "Son, I'm 85 years old, and I'm sitting right across from you having a conversation. It affects something, sure, clearly not fatally." Something shifted in me after that, very slowly, barely noticeable, nothing dramatic. I just suddenly found myself wondering, what exactly am I waiting for? What specific disaster? I'd been waiting 2 years, and nothing had happened. The body was managing. The body I'd spent 40 years studying in operating rooms was working just fine without this little pouch of bile. I thought about a patient I'd once known, Howard, an older farmer whose gallbladder we'd removed when he was in his 70s. The surgeon told him the same things about diet. Howard listened, nodded, and then asked, "Doctor, so bacon's really off the table?" The surgeon said it was best to avoid it. Howard said, "Understood," and from everything I could tell, he kept eating bacon until his last day. I'd thought at the time, what an irresponsible man. I think differently about that now. One evening, Beatrice said to me, out of nowhere, no particular reason, "Clarence, you've been living smaller since they took that thing out. That's a strange trade." I didn't answer her, but I didn't forget it either. I was 86 when the exhaustion finally built up enough that I could actually feel it. Not from the condition, from waiting for the condition. I was sitting in the gastroenterologist's office for a routine checkup, and she said, "Mr. Whitmore, your numbers are stable. Your body has adapted beautifully." I asked her what that meant exactly. She said, "It means it found a way to function without that organ. That happens for most patients." Most patients. I'd worked in medicine for 40 years. I knew this. But there's a difference between knowing something professionally and hearing it said about yourself. I walked out of that office and stood on the sidewalk for about 5 minutes. It was October, a cold wind coming through, smell of something frying from a cart on the corner, and I thought, enough. Not enough with the treatment. I wasn't on any particular medication. Enough with the waiting. Enough with skipping Sunday dinners at the neighbors. Enough with inspecting every plate like I was defusing something. I'd given 3 years to numbers on paper and rules in a pamphlet they handed me at discharge. 3 good years. And at my age, with all due respect, those aren't nothing. No gallbladder. 103 years old. Still here. I called Beatrice from the bus and said, "We're going to Ralph's on Sunday." She was quiet for a second and then said, "I knew you were calling with something like that." She always knew. I didn't throw out any medication, because I wasn't on any. I didn't tell the doctors they'd been wrong. I simply stopped letting fear decide what I was allowed to do. Those are 2 different things, and I want you to understand the difference. That first Sunday at Ralph and Dorothy's, I ate a piece of fried chicken, sat there and waited. Nothing happened. Ralph poured me some tea and said, "You look good, Clarence." I said, "Ralph, I'm 86. He said, "I know. That's what I mean." We laughed the way we used to. That sounds small. But if you've spent 3 years skipping a Sunday tradition that was part of your life for 30 years, the first time you walk back through that door is not small. A couple of months later, Beatrice noticed, "You stopped asking me every morning what I was cooking for lunch before you'd decide whether to go anywhere." I didn't understand what she meant at first. Then I did. I'd been building my whole schedule around food, not around places or people or things I wanted to do. Around the menu. When I stopped doing that, I suddenly had time again. Tyler came to visit a few summers later. By then, he was in his 3rd year of medical school, and he looked at me with a new expression. Not worried, more puzzled. "Grandpa, what did you eat today?" I told him. He was quiet for a moment. "And how do you feel?" I said. "Fine, Tyler. Normal." He wrote something in his notebook. Doctors always write something down. No gallbladder, no Beatrice. Still here. Beatrice died when I was 91. Her gallbladder was completely healthy. She never complained about digestion a day in her life. She outlived my surgery by 8 years, and she was there for every one of them. I think about that sometimes. Having an organ is not a guarantee. Losing one is not a sentence. Life is more complicated than any medical pamphlet. I was 94 when Mason was born. Dennis called and said, "Dad, you're a grandfather. I mean, you're a great-great-grandfather." We both laughed because he got twisted up in the generations. I went to the hospital. I held that small bundle and thought, this is why you don't rush. By the time I was approaching 95, I was still riding the bus on my own. Tyler was practicing medicine by then, and at every visit he'd look at me with this professional curiosity, questions, the whole thing. "Grandpa, any signs of indigestion?" I'd say. "Tyler, I had a pork chop with gravy yesterday. No signs of anything." He'd shake his head, not disapprovingly, more like, "I can't figure this out." I'll be honest with you. Some things did change after the surgery. Sometimes after a very heavy meal, my stomach has its own opinion about the matter, and I won't pretend otherwise. But it's not the disaster they described to me. It's just part of life, the same way you learn to work around the arthritis in your knees, or the way you want to fall asleep at 7 in the evening, whether you like it or not. The body got old. It still works. When I was 98, Gerald called. We've been friends for something like 70 years. He's 2 years younger than me. His gallbladder is right where it's always been, and he calls once a month to complain about pain after meals. Fried food doesn't agree with him, dairy either. He manages his eating with the precision of a watchmaker, and he still suffers. That time he didn't call to complain. He said quietly, "Clarence, they found something on a scan in my abdomen. Don't know what yet." I felt something shift in my chest. Not quite fear for him, though that was part of it. More like an old familiar chill, the kind that says, "Here it is." It comes for everyone eventually. A week later, I went in for a routine checkup. Tyler had pushed for extra tests, as he always does. While I was waiting for the results, I caught myself sitting there listening to my stomach again, thinking, what if they were right back then? What if it's just slow? What if 20 years was the number, and now the bill comes due? No gallbladder, 103 years old, still here. The results came back fine. Tyler said, "Grandpa, everything's stable. Honestly, I'm not entirely sure how, but it is." I said, "Tyler, I don't entirely know either, but there it is." He smiled, really smiled, for the first time in that whole conversation. Gerald turned out to be fine too, benign. He calls once a month again and complains about pain after fried food. I listen. I don't have any advice for him. Our bodies are different. Our stories are different. I just think sometimes about how he spent his whole life managing what he eats, because the organ is still there and it demands attention. I've spent 20 years without the organ, and I don't much think about it. Life doesn't arrange itself fairly. I'm 103 now. Mason is 9 years old, and last Saturday he came over after school and said he had a biology assignment and wanted my help with it. We sat at the table for an hour. He read out loud. I explained what he didn't understand. Then he looked up and asked, "Great-great-grandpa, is it true you don't have a gallbladder?" I said, "That's right." He stared at me with that 9-year-old look, the one where something doesn't compute, and asked, "How does that work?" I said, "Fine, Mason. It's been working fine for 20 years. He nodded and went back to his biology. Kids don't need a second explanation. A fact is a fact, and that's the end of it. This morning I made coffee, fried up some eggs, sat down by the window. My knees hurt, same as yesterday. I get up a little slower than I'd like. But I got up, and I sat by the window, and the coffee was good. No gallbladder. 103 years old. Still here. Now I'm going to say something to you directly, because I'm 103, and I don't have time to talk around things. You're either living without some organ right now, or you know someone who is. And you've probably read about the consequences, the strict diet, how the body will never be quite the same. Maybe a doctor told you that. Maybe you found it yourself online at 2 in the morning. And now you're living with that knowledge, the way I lived in those first 3 years after surgery, listening for trouble, checking everything, pulling back, waiting for something to go wrong. I'm not telling you to ignore your doctor. I'm not telling you to skip your tests or stop whatever you're taking. What I'm telling you is different. The fear that moves into you after a diagnosis takes more from you than the diagnosis does. I gave away 3 years of Sunday dinners at my neighbor's house. 3 years of Beatrice walking over to Ralph's alone because I couldn't verify how much oil was in the chicken. 3 years I could have lived differently. Beatrice died with a perfectly healthy gallbladder. I've been living without mine for 20 years. That's not a moral. That's not a lesson. It's just a fact. Tyler still looks at me with that slightly puzzled expression every time we see each other. He's a doctor now, the next generation, and he keeps trying to find the explanation. I tell him, Tyler, sometimes the body turns out to be more stubborn than we ever expected it to be. He nods, and that's the whole of it really. No gallbladder, 20 years, still here, still sitting by the window in the morning, still having eggs and bacon if I feel like it. Don't wait until you're 103 to stop letting the fear make your decisions for you.